Right, good morning, afternoon, and evening, everyone. Thank you so much for joining us across many time zones for this conversation, looking at sharing lessons and experience and insights from experts around the world on how do we respond to this extraordinary crisis that the world is facing. It's strange to be doing it virtually rather than in person, but also there's wonderful functionality that Zoom offers us. So I'd like to start, if I may, I invite you to look at your chat button at the bottom, click on chat and just send a message to everyone saying, hello. You can tell us where you are, what the weather's like, what you had for breakfast, what you had for dinner, the best thing that happened to you today. But just pop a message in the chat to say hello to everyone so we get a sense of who's here. I'm going to do mine right now. A beautiful day in Casablanca. Frederick, you're also the fastest off the Johannesburg. Welcome. Sunnyvale, California. Look at this. Isn't it? It's lovely to see you all. I can't quite keep up. I can't even type correctly. Lovely to see you all. Welcome, welcome, welcome. So this session is really around bringing a group of terrific experts, and I'll introduce them to you individually. I think we are all struggling to figure out the response to this crisis. It's new, it's fast, the data is unreliable. It's also so widespread. It's not just about an epidemiological crisis, it's an economic crisis, a social crisis, it's a political crisis. And so there's so much to respond to in so many different ways. I think everyone is struggling to keep up with this. So what we want to do was bring together people who can offer a perspective to offer some insights that would be useful to you. Here at Social Progress Imperative, we've been trying to figure out how we can respond in this new environment. And obviously, we're not experts on infectious diseases and aren't experts on measuring data for some of these, the spread of COVID-19. I just want to share with you quickly a couple of things that we have done to try and inform the response to COVID-19. The first of which was to produce what we call a measure of social resistance to infectious diseases. As many of you know, Social Progress Index is built across these 3 pillars and 12 dimensions. And it seemed clear to us, and some data analysis showed us, was that if we look at infectious diseases, 3 particular aspects of social progress really matter. Water and sanitation. Are people able to keep clean? Shelter. Can people keep themselves safe and sheltered away? And also, is health and wellness? Is there a good health system? Are people already healthy? And when we analysed countries' performance on this, we found there was a broad pattern that on the whole, richer countries showed a higher level of resistance to infectious diseases, but that wasn't entirely about wealth alone. So here on this chart, we plotted our measure of social resistance to infectious diseases against GDP per capita. And on the whole, we do see that richer countries do better. Switzerland had the highest score. But even within that, we see that there's noise around the trend line, that we see that there are countries that, for example, like Brunei Darussalam, UAE, Oman, and others, that seem to be performing less well on these measures compared to countries of similar wealth. We also see that there are countries that are doing much better than their GDP would predict, such as Costa Rica and Jordan. And so in terms of the readiness of countries to address this disease, yes, wealth matters, but actually there are other factors as well that are part of this social resilience. We also separately, for the United States, decided to look at the particular vulnerability to COVID. This is based across data coming out from the US Centers for Disease Control, looking at what drives morbidity from COVID-19. And it seems clear that things that drive higher levels of deaths from COVID-19 include the quality of the health infrastructure, the underlying health of the population, and also the demographic of the population in terms of, principally in terms of age. And on the back of that, we were able to map out the vulnerability of the 500 largest US cities. And what was striking, of course, was that the first big outbreak in the US was in New York City. But actually on this measure, New York was only 250th out of 500 cities. There were a lot of cities much more vulnerable in New York if and when the virus hit. And indeed, the most vulnerable city of all was actually, by some margin, Gary, Indiana, which had a very, very high vulnerability score. And indeed, a lot of cities in the Rust Belt and also in Florida look very vulnerable to this disease if it arrives uncontrolled. We also can look, as you see, can look into cities, and we can see that a city like Atlanta, for example, has a lot of, has a lot of variation within it. Even if there's not a very high score on vulnerability for the city on average, there can be huge disparity. And we can also drill down to each of these communities, each of these census tracts, and look at the profile of those communities. And one of the findings we see very clearly from our data is that there is a particular risk to the African American population, which I think is a very important message for us about how COVID is not just about the virus, it's also about the way it preys on the underlying inequities within our systems, and why we need to think about COVID in a very wide framing. So that's just a couple of pieces of work that we have done to try and use data to inform the response to COVID-19. And we'll pop a couple of links into the chat so people have got those if you've not seen them already. I want to begin by, first of all, I'm delighted that we have been joined by Dr. Torolfur Gudnason, who is the head of the Department of Infectious Diseases Control from Iceland. Iceland has had an incredible record in controlling this disease. And so we're really honored, Dr. Gudnason, that you're able to join us and to share a bit about what's been the success in Iceland and what are the lessons that could be shared for other countries. Dr. Gudnason.
Yeah, thank you very much. First of all, thank you for having me with you on this program. I'm not sure exactly how much people know about Iceland. Iceland is an island in the middle of the Atlantic Ocean with about 350,000 people. So it's a fairly homogeneous society. So it's for us, it's relatively easy compared to many other countries to deal with epidemics and pandemics like this, I would assume. So what has been the key to our success, in my opinion, is first of all, I think we were prepared. We had preparedness plans, and we have been working on our preparedness plan for many, many years, since 2006. We have updated them, and we have used the preparedness plans for pandemic influenza. In our plans, we have visualized how we're going to organize our response, which partners are involved, and who is responsible for what. And we have a firm legislation, and we are working very closely with the civil protection. And we use the same approach to every single health hazard that we are facing with in Iceland. And we have many health hazards in Iceland, mostly from natural causes like earthquakes, bad weathers, avalanches, volcanoes, and so forth. So we had our plan in place, and we decided from the beginning that we would track down we would use extensive testing, and we would track down all possibly infected individuals connected to our cases. And we established on the first day a contact tracing team consisting of police officers and healthcare officials. And they were very aggressive in contacting all possible contacts, and they were all put into quarantine. And all visitors Icelandic visitors in the beginning from abroad, mainly coming from the Alps, Italy, and Austria, they were also placed in quarantine as soon as they came to Iceland. And we think that this has been the key to our success, the quarantine and extensive contact tracing. And as a marker on that, about 60% of all cases we have diagnosed have already been in quarantine at the time of diagnosis. But we did not shut down the society as a whole. We have put some restrictions to tourism, but we are opening up again fairly rapidly at this moment, and we have not seen any relapses for the past month or so. So this is in essence our success story so far. But the challenge now is, how are we going to open up? How are we going to open up for the tourism? Because we know that the prevalence of the infection in the society is probably not more than 1 or 2%. And we base that on a zero prevalence study that we have been doing. So the next few months are going to be very challenging for us as far as the borders are concerned and how we're going to open up. And we have some plans now to ask everybody who's coming to Iceland to either go into quarantine for 2 weeks or have a test at the airport when we come to Iceland and a close follow-up within Iceland.
That's great. Thank you very much, Dr. Gunnarsson. It's just a perfect segue. Our next What Works Forum in a month's time is going to be looking specifically at this question of reopening economies and how we do it. So we're moving quickly to this next stage of the crisis. And I think, I mean, two things that you said that I want to highlight in particular. I mean, one is, I think, this interesting question of, does a more homogeneous society, is it better able to control a disease like this that does have this social perspective? I think we'll only know later, but there is an interesting dynamic about this disease. I think secondly, also, there's a lot of countries have had resilience plans, but I think we'll learn a lot after this crisis about which countries actually had effective plans and had invested in them. And it seems that the lesson from Iceland is that Iceland continued investing and was ready in a way that I fear some other countries weren't.
Yes, I agree.
Thank you very much, Dr. Gunnarsson. Now, let us take a trip across the Atlantic to another country that has done very well on this, on addressing COVID, which is Costa Rica. I think we're seeing a lot of headlines now about how the epicenter of the disease is moving to Latin America. But Costa Rica has been a real exception and seems to be handling the epidemic very, very well. So I'm delighted that we've got Andrea Prado from the Inkai Business School, who's been part of the effort to tackle this. So Andrea, thank you so much for joining us. We'd love to hear more about how the very broad way that Costa Rica has responded. And particularly, as those who know Social Progress Index data will be well aware, Costa Rica is a real outlier in its level of total social progress. And has that been a factor that's actually helped Costa Rica to respond?
Thank you very much for the invitation. And yes, I must say that the fact that we have invested for decades, not just in the health system, but in education of the population, are providing us the fundamentals to be able to face this crisis successfully so far. We reacted quickly, and I think that's one of the success that we did to respond to the crisis. We closed the borders 13 days later. But I think to face this crisis is not, again, just a simple response like that, but we have to understand how the health system actually works. So in Costa Rica, for instance, we have universal health coverage. So the state is actually responsible for the health of all citizens. So nobody in the country, not even the foreigners, have to worry if they get sick on whether they have to pay a bill or not. And I think that's absolutely key, because that is provides the fundamentals for the national health system. This national health system is responsible to provide the response to a pandemic like this. So there is something that is absolutely key is, one, it is very clear who is the responsible. And within that system, the Ministry of Health is the guiding institution for all health matters. So there is we don't have to waste time deciding who needs to take care of what. It is very clear who reports, and the ministry constitutes a political arm that reports directly to the president and coordinates with the rest of the institutions. And that coordination is absolutely key. And another thing that actually allows for that, and that this national health system leverages, is the level of education of the population compared, for instance, to countries around in Latin America, because we have 97% of literacy rate. So with a clear message, the population in general can follow instructions. They can follow instructions from the governmental institutions, and also something that contributes to following instructions is the confidence that they have in the in the government or in the public institutions in general to lead the way of what has to be done. To support this system and the operation of this response, it is important to understand, one, that we also have a national public laboratory that provides or conducts all the testing. That's one institution, also public. Then we have a national digital record that provides the support. Each person here in the country has a medical record, and that you can access it from anywhere in the country. And finally, the way we have been financing the Social Security allows for this institution to have a budget to actually make the investments that need to be made, both in infrastructure. We develop a whole COVID hospital, but also in equipment, in respirators, and all that. We do have a budget, and that's thanks to the way the Social Security has been, or it's regularly financed. So I think that has been some of the things that have provided the fundamentals for the success of that Costa Rica so far has had with the response of this. And I believe the challenge that we face now is, unfortunately, our neighbor country has not taken any measures. And there is a traditional migration from Nicaragua to Costa Rica, and that is now what we have, what we're dealing with, because people are moving into the country in illegal ways through different parts of the border.
So as ever, this threat changes in different ways and new threats emerge. Thank you, Andrea. I mean, I think it's very striking how there are parts of the response are about, again, investments that have been laid down over a number of years, whether it's in the education system or in the health system. And it's that state of readiness that's been critical in allowing Costa Rica to respond so effectively, and in having the right kind of resources. I think I'm also very struck to your point about the leadership role of the health ministry. That having that very clear leadership and coordination role helps the response to be more effective. Thank you so much for sharing that experience. For those who joined late, welcome to the What Works dialogue. Thank you to all of you for joining at different times of day and night. Thank you also to Cognitio, a social progress imperatives partner in putting on the What Works conferences, and also to our supporters and sponsors, Deloitte, Amazon Web Services, the Icelandic Prime Minister's Office, and the University of Iceland. And also to IQ Business in South Africa, who have been one of our key partners in putting this all together. Now, we've been from Iceland to Costa Rica, and now we're delighted to have Robert Blaine, the Chief Administrative Officer of Jackson, Mississippi, with us. Dr. Blaine, welcome. Glad you could be with us. I know we're here to talk about COVID, but I know the eyes of the world are on the United States at the moment. Could I perhaps begin, Dr. Blaine, by asking how things are in Jackson at the moment?
Thank you, Michael. Things are well here. One of the things that we've been acutely aware of are the vast inequities that have been exposed by both this pandemic and our recent civil unrest. We've had protests here in Jackson, but they've been very peaceful, and we haven't had any violence or destruction. So things have been good here so far.
Good. Now, I mentioned the SBI has been doing the work on looking at the vulnerability mapping to COVID, the differences, including Jackson. Tell us a bit about Jackson's response and some of the ways you've been responding to the crisis and some of the challenges you're facing moving forward.
Sure. One of the challenges here is that Jackson is a municipality inside of the state of Mississippi. Mississippi is one of the poorest states in the U.S. And we operate in a vacuum where we have a fairly liberal municipal government inside of a very conservative state of Mississippi, which means that we've had some contrasts in the way that we have responded to the challenges of this pandemic. One of the things that we've been focused on is trying to build data systems that will inform the way that we respond and give us information to be able to give support to our most vulnerable communities. We have built essentially a 4-dimensional map of the city of Jackson. We use the Social Progress Imperative Vulnerability Index as our foundation to try and identify areas in the city where, especially there were inequities of healthcare and access to healthcare across the city. We layered on top of that what we called a symptoms collector. And so essentially this was a website. We partnered with an artificial intelligence group where citizens were able to input their symptoms around the city. And there's an artificial intelligence tool that we're training that will recognize a COVID-19 cough from another cough. Some, say, for example, an asthma cough or a cough from allergies or something like that. And so we're hoping that training this artificial intelligence tool is going to be able to give more resources to point people in the right direction of the resources that are needed. And then we partnered with the state in order to build a 3rd dimension of the map that looks at infections across the city. That layer of the map is actually at the census tract level, so it's per 2,000 citizens around the city. And then finally, the last layer of the map looks at contact tracing. And so what we've been able to do is to use this map to be able to mobilize resources in the city in areas that need it the most. So we partnered with a community health group, and we equipped a bus full of testing supplies and the like. Just yesterday, we came back from a housing complex where we were able to test almost 100 residents there. And so we've been able to use that to be able to drive resources into the most needed areas in the city. One of the things that we're really excited about is that we've been able to establish new partnerships. And so one of the partnerships that we're now really looking into is a partnership with the World Economic Forum to use wearable technology as an early indicator of infection. One of the early indicators is increased heart rate. And so by being able to have vulnerable populations wear essentially watches or Fitbits that would be able to measure their heart rate, we can have an early indicator if there's infection in those communities, especially with our most vulnerable citizens. And then the last partnership really looks at how we can start to have a more robust contract tracing environment. And so this is a partnership with Harvard University, where we're looking at an app that will, where all of the folks that are registered are rather infected, register in the app. And it then allows citizens to be able to know if they're in contact with anyone that has been infected, and it gives them information for them to get tested or to be screened. So, so we hope that we're going to be able to reduce the curve here in Mississippi. We see the curve is increasing quickly here, and that's inside of an environment where the state is opening up. And so we're having a real push and pull here with the restrictive resources that we're trying to put in place and the kinds of resources we're trying to give to the community, and then the contrast with the messaging that's happening from the state and the federal government about opening up.
Thanks, Robert. Yeah, that's a very complex balancing act with the city versus the state versus the federal government. Maybe just a quick question. I think something we've heard from Dr. Gunnarsson and from Andrea Prado is about the capacities that the governments had that allowed them to respond quickly. Well, what's made Jackson be able to respond so sort of effectively, so quickly to this crisis?
I think that these data ecosystems are not new to us. So we were prepared with the level of data that we could bring together the resources to be able to track things quickly in the city. And we also have a history of data-informed decision-making. So the partnerships that we've had, for example, with the Social Progress Imperative, and really looking at data around the city with the ways that we've been looking at all kinds of different interventions in the city, meant that when COVID came, we were able to leverage that infrastructure in order to be able to adapt.
Thank you very much, Robert. Now moving another geography, I think one of the countries where the epidemic is moving quickly, there are some real dilemmas about opening up, where there's also some real vulnerability to the disease is in India. So we're delighted that we've got Sampriti Mukherjee here from the Institute of Competence India, who's here to share some analysis about the vulnerability of India to COVID-19. Sampriti, welcome. What is your research? What is your research showing us?
Right. So the Institute for Competitiveness has created an Indian state COVID-19 vulnerability index. This was done particularly to focus on the physically vulnerable population, that is the elderly population, as well as the people with comorbidities or chronically ill. So the findings that emerged from this index showed that the least dense states have done better because of reduced stress on health infrastructure. So across the board, Himachal Pradesh, a state which is predominantly hilly, has come out as the most vulnerable because of its high elderly population as well as its high comorbidity population. However, if you were to track and see the fatality rate, COVID fatality rate, we see that it's very minuscule. It's about 1.3% compared to the highest fatality rate right now, which is about 6.1%. So how has that happened? That has basically happened because Himachal Pradesh has a very good health infrastructure compared to other states. The state government has also taken a very proactive measure of finding out COVID patients through mass testing, through something called active case finding strategy. So they have tested all patients, all citizens for influenza-like symptoms. They have also carried out certain COVID hospital, COVID care centers, where they're designating particular patients according to the intensity of COVID. So we have also tried to bolster our argument by trying to see the correlation that has come up using the state COVID data as well as our health infrastructure and the other pillar data. So we find that the most vulnerable states have actually a higher number of cases of deaths. And also, however, the most states which have better health infrastructure have fared better, even if they're the most vulnerable. Even the states which are most vulnerable have higher susceptibility to COVID-19 positive cases. So as we start to reopen and resume operations, it is very necessary that we actually look at this whole aspect of vulnerability, the physical vulnerability, and keep the elderly population and comorbid population in mind when we're trying to reopen the population. So I think as we resume operations and start our whole economy again, it is important that we look at vulnerability from this aspect, and not only vulnerability from the physical vulnerability, but also socioeconomic vulnerability. So that is very important.
Hey, thank you very much, Sampriti. It's a great piece of work. There's some real depth of data there. And I think, again, vulnerability isn't destiny in that sense. It's about the quality of response is being critically important in the actual death rate. And that's very important to remember. There's a lot to play for here in how well different governments are able to respond to this. And there's an extraordinary amount of comparative data coming out from India, depending on the different states' responses. Thank you so much. Now we can take a turn and look a bit more at the business response to COVID. And delighted that we're joined here by Deirdre White, the CEO of Pixera Global. Pixera is a non-profit, but works with businesses around the world in different ways, looking at social and health issues. And Deirdre, there's been a real sort of pivot in your work in response to COVID, hasn't there?
Pivot is a good word. It's been a major pivot. And to follow up a little bit on India, we have a program where we work with John Deere Foundation in rural Rajasthan. And we have been working in upwards of 30 villages there, I think about 35 villages now, for the past decade, or building the number of villages over the past decade. And we work on resilient agriculture together with these communities, and accountable education and small scale infrastructure as it supports agro-education. And one of the things that was a fascinating finding for us here, and terrifying finding, was that when we made the decision to move all of our team to work remotely, or all of those at least that do not live in the villages but live in the regional capital, we started calling out to the farmers that the team normally makes regular visits to, and the education resource centers. And we learned really quickly that only 1 in 6 farmers in these villages had even heard of COVID. So no knowledge whatsoever of the disease and of how to protect themselves from it. So the team whose intention in calling was to say, hey, we'll be available by phone or other means to be able to provide any extension support or support to the teachers, etc. They quickly pivoted and found themselves actually calling out to as many families as they could reach as possible to directly share information on how the communities could protect themselves. You know, as I listen to a lot of people talk about vulnerability and all the aspects of vulnerability in our, in some of our work, we've seen the vulnerability be at its core just in the utter lack of information as a starting point. I want to shift for a second to the US and some of the work we're doing in the US. So we put together something that we're calling the Reimagine Series Challenges, where we have leveraged our corporate partners together with some large, influential organizations across the US who have posed challenges about their own future development, that we will bring together multi-company cohorts to actually try to bring some new solutions to. So for instance, we are embarking on a challenge with NAC to look at what they need to be doing around telehealth and telemedicine to support their membership across the US so that they can better serve healthcare to the communities that need it in the next crisis, or to build up that capability over time. It's a really important issue, and it's one that everyone's been talking about for a long time, but no one's taken on in a really comprehensive manner. And while these community health centers are addressing the immediate challenge right now, we're going to bring in some outside cross-sector expertise, cross-company expertise, to work with NAC and to work with the Primary Care Association of Iowa on a state level to sort of see how you can address this problem in multiple ways. We're also working with several of your municipalities and states on similar challenges, many of them around minority-owned business recovery post-COVID-19.
That's terrific. Thank you very much. Because, yeah, this is the thing, after we get through the immediate crisis, how do we build back better has got to be part of the agenda. And I think moving to that conversation as quickly as possible is going to be really important. I think also extraordinary range of challenges you've been working on, Deirdre, highlighting the importance of learning between different countries, Nigeria to India, that kind of learning, especially in a fast-paced crisis like this. We've got to be able to be broad in our learning if we're going to be able to pick up the best ideas. Now, keeping on the business theme, we've got Chet Matchett here from ATB in Canada, which is a bank. And Chet, how is a bank responding to the COVID crisis?
Thank you for that, Michael. Hello, everyone, and thanks to my fellow panelists. I'm certainly going to be leaving here today with a ton of inspiration. So thank you for sharing your stories. First, a little bit of context about ATB, because I'm sure the majority of the people on the call have never heard of us. So we're a crown corporation in the province of Alberta in Canada. Alberta has about 4.3 million people. We have a customer base of just over 800,000 and an asset size of just over 55 billion. So just some context there. Also, ATB was formed in 1938 on the heels of the Great Depression, And really the reason why we were created was because a lot of the larger banks were pulling out of our province, leaving farmers and people really struggling and looking for support. And so ATB was formed from the government with the purpose to provide hope for Albertans and their future. And so with COVID, we really see this as an opportunity to connect with our roots and the reason why we were created and why we exist. So in terms of our response to COVID, we were in a really unique position where patient zero in Alberta just so happened to be one of our team members that were working in one of our branches here in Calgary. And so our first thing that we did was an immediate response for our team members to ensure that everyone was safe. And that involved making sure that we had the ability to quickly mobilize people to work remotely. And we were in a bit of a unique position there because working remotely has been part of our culture, but certainly was a unique problem for us to solve in terms of getting, we have 500 people working remotely typically to over 5,000 people working remotely. So that was the first thing that we focused on. The second thing that we focused on, of course, was how can we be there for our customers? And so a couple of things that we did right away is start to defer all loan payments to make sure that we gave our customers some slack and some comfort. When I think about the longer view, there's a big opportunity that we're thinking through and working through. One is from an economy perspective, we've been calling this the double black swan for Alberta. So not only is it a health crisis, but there's a huge economic crisis for us. We're highly dependent on the oil and gas industry, and I don't need to go into color to explain exactly what's happening there because I think we're all aware. And so we're looking at how might this be an opportunity to look at diversifying our economy and start thinking more longer term. Also, when we think about long-term, really proud of the partnership that we've created with SPI, and we've recently just finished creating 35 different indices across the entire province of Alberta. And so we'll be leveraging this data and going to market with it soon in order to help highlight the populations that are most vulnerable across Alberta, as well as start to align all of our corporate social responsibility in a really data-driven way so that we can focus on the highest social economic problems across Alberta and focus on solving them in partnership with many organizations. And I think for us, what's exciting about that long-term view is because we only operate in Alberta, there's such a positive correlation between an increase in economic growth and an increase in ATB's financial growth. And we know that the system of economics is far greater than just focusing on GDP. And we know that if we can focus on social issues and help more people participate and thrive in our economy, the longer term is that we can create a more prosperous society for all, which in turn really benefits ATB. And so that's our thinking and strategy for longer term.
Right. Thank you so much, Chet. I mean, ATB is, as you said, a very unique institution as a Crown corporation, which gives the bank a very particular perspective on its role within the state that clearly has sort of influenced the response. But also, as you said, case zero being within the bank meant that you actually got ahead of this and really played a big leadership role in this. And I should just say for others' benefit that we're delighted to be working with ATB on developing a social progress index for the province that I think should be a great tool, and it's been a great collaboration. So thank you, Chet. Moving now, keeping on the business theme, to South Africa. Adam Kraker is the CEO of IQ Business, one of our partners in this series. And Adam, IQ Business has been very much grappling with the direct economic impacts of this first phase of the COVID crisis. Can you tell us a bit about what you're doing?
Michael, it's great to be here, and as my fellow presenters have said, really amazing to hear the information that's being shared today. So if I may, I'm going to prove that consultants have separation anxiety if they talk without slides. I want to introduce Cobra to you. Cobra stands for the COVID Business Rescue Assistance Initiative. And this is really, when we think about vulnerabilities and priorities in the business sector in South Africa, this is our response to that. You'll see that we've created an ecosystem that recognizes that there are really three key players within this structure. There are businesses in distress that have very rapidly fallen into various levels of challenge. They're external stakeholders that tend to be their creditors and debtors, the banks that are their providers of funding, the role of government, and then we have a wide range of business associations in South Africa that engage across various sectors. And then the third component is what we call the Cobra Consortium. And when we formed the Cobra Consortium 76 days ago, we had 3 major players. And since then, we've been joined by another 40 organizations that have come into what we call the Cobra Partnership. And the context really around this is that South Africa had a severe economic crisis prior to the health crisis that is simply exacerbating the situation. The context of our economic crisis is that we had just entered a technical recession prior to the declaration of a state of national disaster in South Africa. And a week later, we entered a period of lockdown. We've now been in lockdown for 74 days. And we have government has introduced 5 levels of lockdown, very similar to other nations around the world. We were at level 5, the most severe level, which is a basic shutdown of everything, only essential services operating in order, of course, to address the health challenge. And the context around the health crisis is that so far in South Africa, we've seen in the region of some 37,500 infections or cases, and climbing to around 800 deaths at this point. So the feeling is that lockdown has helped us contain the growth of the situation and help us to buy some time. There is a dual context, of course, which I think we all now understand, that there are these 2 imperatives that are in play. The first imperative is to safeguard lives. And very similar to what I heard in terms of the focus in Costa Rica and, of course, in other nations around the world, flattening the infection curve is the major and most effective way to do that. But the second imperative of safeguarding livelihoods is really critical for us in South Africa. Prior to the lockdown commencing, we were already approaching unemployment levels of around 30%, 30%, with youth unemployment rapidly approaching 60% in South Africa. The effect at this point of lockdown and the health crisis on our economy is expected to contract GDP growth. And I know GDPs are not our most popular metric of performance within SPI, but a contraction of up to around 20% is forecast for this year in the South African economy. That's really critical. Recognizing that we've seen a rapid number of businesses going into distress, and government is predicting that we're going to see some 700,000 enterprises from the informal sector, the formal sector, from closed corporations and sole proprietors through to large, very large enterprises. And indeed, the South African Airways national airline is already in business rescue, as is a range of other businesses. So we've created Cobra that delivers 3 lines of service to really address the situation. Firstly, to make sure that businesses and business leaders have got the best technical support and information that they can access to enable them to work through the economic crisis. Secondly, we're using bankruptcy protection, which is highly underdeveloped in South Africa. We call it business rescue, to guide those businesses through a structured and sustainable relaunch of the business into the economy. And thirdly, very importantly, where necessary, and quite frankly, there are many businesses that will not make it through the economic crisis is to help them rapidly manage the insolvency and liquidation process to preserve their underlying assets. And Michael, the last thing that I would say is that I mentioned that prior to the health crisis, we were already approaching 60% youth unemployment. And as you know, last year, we ran the first subnational social progress index in South Africa. And this year, in fact, in 2 weeks' time, we launched the first youth progress index, which is very, very exciting to get a real grip and an understanding on the measures and steps that are being taken to tackle the situation in South Africa. And the context for us here is that we expect that infection rate to only peak in September. So we are early into the critical situation that we face in South Africa and really looking to leverage and learn from other countries as we can.
That's terrific. Thank you very much, Adam, and also modeling the standing up Zoom call approach that I'm sure is be a lesson for all of us for our health, so we're not sitting around all day. I know you have to rush, but very quickly, the Cobra initiative, I think you're also looking at expanding to other countries. We are,
Michael. In fact, through our association with the Young Presidents Organization and through IMD, as I can see behind me here, we have paralleled the launch of Cobra into Kenya and into Mauritius, and then also into New Delhi in India, through the Jagriti Yatra organization. Interestingly, in India, the team in India said, well, we don't really want to call it Cobra, so it's going to be called Jaguar in India for very good reasons. So, but the same approach, the same platform, bringing together organizations to support businesses in distress and make sure that they can be sustained through the economic crisis that's caused by the critical health crisis.
Adam, thank you so much. I know you have to run. I wonder, I've got on the line, I see my good friend and SBI board member, Matthew Bishop. I wonder, Matthew, whether you might be able to be willing to offer a couple of reflections on what you've heard.
You know, I think the Icelandic story, again, so interesting in terms of what's not happening in America and in Britain where you are, in terms of just the comprehensive approach to testing and having when you do invest in these infrastructure services, same story in Costa Rica. You know, when you have got those things that get you a good score on the social progress index, this pays off in terms of your ability to respond effectively when a kind of shock like a pandemic hits you. My hope is that we quickly move to the debate about how do we build back better, that we look to the places that are highlighted like Costa Rica, like Iceland. There should be a global appetite from this first really truly global crisis of pandemic to learn from the global best practice that is out there and that we've heard a lot about this morning.
Great, thank you. We'll be back here in a month's time for another What Works webinar, bringing together experts to be talking about these issues, to see about how we can respond better to this crisis. So thank you all for contributing. Special thanks to our speakers, Adam, Chet, Deirdre, Sampriti, Robert, Andrea, and Toril Ford. This time, thank you for all your contributions and joining us. Special thanks to our partner, Cognitio, partner with Social Progress Imperative on this, and also to our sponsors, Deloitte, Amazon Web Services, the Icelandic Prime Minister's Office, and the University of Iceland. And thank you all of you for joining. Looking forward to seeing you again in a month's time to continue this discussion. And looking, if you've got ideas to share, experience to share, let us know. We'd love to have you as part of this conversation. If you know good people, let us know. Thank you all. Have a great day. Stay well, stay safe. See you soon.